Great. Thank you, Eric. And thanks to the GPEC community for joining us today. We did this webinar together really to not only share our nation, but to recognize the depth of what's happening in our economy. And I'm so glad to have two friends join, Peter Ryan and Jim Rounds, to talk and reference going deeply in this community. First and foremost, what I want to say to our GPEC community, not only investors, stakeholders, the community leaders that are on this webinar, but all our staff. They've been working tirelessly around the clock to ensure that we're in the community's needs as we enter this time, which many of us of 2008 had not experienced previously. So certainly the COVID-19's led us to an unprecedented time. I can tell you out of the gate is been very aggressively interacting with the companies in our pipeline, of which there's still 300 companies evaluating this market. And as we've done so, we found that a majority of 90+% of those companies, while taking a pause, are still actively considering investment decisions into this year. And so while we've seen just unprecedented uncertainty occur globally as COVID has spread, and I understand the governor's making an announcement, could be as we speak at 2 o'clock today, with some additional focus of how we put the major emphasis on our people and the safety of our citizens. So, one of the things I wanted to also reference as part of the GPEC community is really the number of frontline healthcare workers that day in and day out are taking care of our friends and family. And there's no one that hasn't been affected now by the COVID expansion into Arizona and the country and around the world. So I just want to recognize those frontline workers that are doing so much work on behalf of our community, and they need to be recognized. In addition to this, the city and county and state leadership that we've observed and really coming together. One thing that I've had experience of now being here for 16 years in Arizona is how resilient this community is. This community comes together in trying times and finds ways to help one another. I just left a call that Jim and I were both on with a number of other community leaders talking about giving a hand up to your neighbor. And that's what it takes in these challenging times to get through what we're experiencing. So with that, I want to also shed a little bit of light on the economy and what we're seeing. So a couple weeks ago, I think it was a month ago now, I was talking to a number of business leaders, and we were talking about what could become of COVID-19, and ultimately kind of the general feedback loop was that it's really likely to be growth interrupted, meaning growth would likely stall, or we'd see an eruption in growth, but everyone is prone for that growth, and we'd get right immediately back on track. 2 weeks ago, I had a similar call with other business technology leaders, and there were views of massive disruption coming. Weeks, there was immediate change of tone and tenor around what's going on in this economy, and largely because of the reliance on small business in our community. So statewide, 99.4% of our businesses are considered small business by the SB. And so we are a market that see being influenced and impacted more significantly because the working capital needs of small business, but also we're a place that people come visit. We're the fastest market in the country. And as such, people here, particularly in this time, to warm weather, are a great community. And so when you see what's happening, it's certainly alarming. But again, confident this community is resilient. It'll get back on track. But over the weekend, I'll finish with one final sentence of a call I had with a number of companies similar to the ones I had mentioned. And while we're all planning with our communities for Small Business Loan Act through this new relief fund that's coming, and the massive amount of cash that's going to be available to support domestic global liquidity, the term that kept coming up, unfortunately, with a lot of these small business enterprises was feeling decimated. And so when you start hearing this level of impact, and ultimately when we're in this safety precautionary measure, we're seeing less spending in our community, small business and even large businesses in that case. What that portends is the impact on state and local tax collection as well. We're a region that's heavily reliant on sales tax spending, or sales tax leading to or spending to sales tax. As a byproduct of that, I've had a number of calls with our city leaders talking about what are the short-term strategies that we can deploy together to ensure we can weather the storm, and come out on the other side while still continuing to support our citizens with public. So we've never, even arguably in our lifetime, experienced such sharp turn down in the economy like we've experienced. But what I'm uplifted by, over the last 3 weekends, I've had calls and meetings with a number of these city leaders and state leaders, and what the governor's done to organize the Arizona Commerce Authority and the Arizona Together message, along with the county and cities. We have cities planning for short-term bridge loan programs. That's really a bridge to a bridge. It's a small business capital in the queue for the SBA programs. These are the kind of things that, again, you're not seeing across the country, but you are seeing here in Greater Phoenix. We're working to tackle this issue head on and work together to address that. Another major move that we've observed and worked closely with our peer organization, the part of innovation in the Pipeline AZ program, over about, it was 4 days, they put together a C19AZ.com program that's really focused on how do you help this massive number. We're talking 150,000 plus restaurant and hospitality worker immediately located. How do you help that significant number of people find immediate lateral job opportunities? And so they immediately went to work, created a web portal within the broader platform that helps these individual job seekers find immediate employment, really tied into all the corporations that are out there to hire as we speak. So what I'm just excited about is, we're in some very trying times. This community just comes together and finds really creative strategies to affect outcomes for the citizens. And lastly, as it relates to the philanthropic community, which again, I don't want to understate the importance of our philanthropic community. Just in the last few weeks with their Community Foundation, United Way, and the governor standing up the Arizona Together, we've seen the philanthropic community come together, work with school, work with the needs of our community. And we're seeing, as a couple of calls I've had recently, homeless populations, domestic violence, the hard NGO work that has to happen in this community doesn't go away when you have this kind of economic peril. And so as a byproduct, again, we talk about communities stepping up, working together, citizens stepping up, working together. Those kind of things that separate this region from everywhere else in the country is our willingness and ability to work together. So, on the economic front, I'll close with this. I do believe we'll get through this. I do believe that the next 6 weeks are going to be extraordinarily challenging economically while we're experiencing the healthcare hardship that's underway. And look at some of the models I'm sure Peter talked about. This is not going to end tomorrow, nor is it going to end by Easter, nor is it going to end weeks to follow. This is going to be a requirement of the community in a battle test for our community. How we come together, state, regional, local leaders, to put together programs to help thy neighbor, small business weather storm. And as we come out on the other side of this, what I do expect, because we're a place that has very strong operating environments, we have strong labor pools, we have a tremendous amount of company attractability. We will come out of this very, very aggressively when time comes. And I'm excited just to see those companies and communities that are working together. And as we work, over the next 8 to 10 weeks, I'm hopeful that the nose of this plane will come back up and be back to business. And I'm just to play a part in that with a number of our peer organizations that are on today.
Chris, I want to thank you, obviously, for everything you just said, talking about the economic impact, especially holding our neighbors up. I think what we've seen recently is that's exactly what's happened, people stepping up and being there to lift their neighbor up. And I want to transition over to Peter Fine now to talk about the healthcare impact and the challenges that they're seeing. Banner Health, one of the nation's largest nonprofit healthcare organizations, operating 28 hospitals in 6 states. Banner employs over 45,000 people. Peter, I think all of us, we just personally want to say thank you to you, your teams, everybody from the nurses to the physicians to the administrators, the work that you have been doing. So I'm going to give the floor to you, and just if you can, kind of give us a state of the situation when it comes to the healthcare impact we're all experiencing right now.
Sure. Thanks, Eric. Obviously, there's a economic reality, but then there's a pandemic response. And we are dealing with something none of us have had to deal with, certainly not in my career. And so we're learning as going, and we're reacting to the information that's being put in front of us. And that's about the best we can do. And some people may not like some of the responses, but in fact, we're reacting in a way that is associated with the information that we're learning along the way from other places around the world, and certainly other places in the country. So we know that the US has the number one country with the number one number of confirmed cases, more than China. The interesting thing is our population is only about a quarter of what China is. So that percentage issue is a bit concerning. We know we've had a slow response to what's been going on in the country, and it's been more in line with more Italy as opposed to Taiwan and Singapore, which jumped on this very early. So their results are much better, and their problem is not nearly as significant as our problem. They jumped on testing very early. They produced the products they needed to produce to allow that to happen. They isolated, they traced, and then they practiced extreme levels of social distancing, which is a key, and I'll talk a little bit more about that as we go on. Right now, there's no treatment or cure. It's just managing the cases as you see them in front of you. We did hear today that J&J believes it has a vaccine that they're going to start trialing in September, and if all goes well, could have a vaccine first quarter of next year. They're preparing to create 1 billion doses of that vaccine to put it out into the market. Obviously, we'll create more if it's that successful. That's the first hope that we have seen of something real that will happen quickly, and getting rid of all the regulation associated with getting a vaccine in the market, which could take 18 months typically. To do that by having it available by the first quarter of next year would be quite significant. We also know the problem for us in Arizona, if I bring it down a little bit, is we've got the lowest number of tests per capita than any place in the US. And that is very upsetting, very disconcerting, and in fact, prevents us from identifying and isolating quickly enough. Why that is, many reasons for it, many of them not understood, quite frankly. And testing kits and the availability of testing kits has been very, very difficult to obtain in this particular state. And as the data shows, being the lowest testing per capita is really directed more importantly to the lack of the availability of testing kits in this state. So that's been a difficult negative for us. Banner, for example, has established 4 collection drive-throughs, 3 in the Phoenix marketplace, 1 in Tucson. We've had those up and running now for about a week and a half. And while we have been putting people through those areas, mostly and only for people that have tested positive for the virus, we're running out of tests. And again, we're at this issue, are we going to have to close these down in a week because we can't get the testing kits to support them? And now the health department has changed things to the point where they're prioritizing who can get a test. And right now, healthcare workers are a key, so we're moving them to the front of the line when they call to get a reservation for one of these drive-through tests. And drive-through tests are important because it keeps people out of our emergency rooms, keeps people out of our urgent care facilities, and it saves on personal protective equipment because they don't need as much as they do when they're in a hospital environment and have to change things between patients. So that prioritization is a factor now in our ability to have community testing. Banner has gone ahead and stood up virtual visits. These are our urgent care, which is important because it's again a way to identify issues that are out there and do it in a virtual way rather than an in-person way. In fact, if you go to www.bannerhealth.com, you'll see a symptom checker that we've put on there. And you can work your way through the symptom checker, and as you get through it all, if you see you have symptoms that are associated with this problem, it then can connect you in a virtual way with a physician to get further advice and counsel and determine on whether you need to go to an emergency room or don't. Remember, 80% of these patients are going to have mild symptoms and can be managed at home, taking proper care. They don't have to be running into a facility. It's only when you have certain symptoms that advance in a way that requires that next level of care that you have to go to a higher level and higher order of facilities, such as an emergency room. We are doing significant amounts of surge planning with our own organization and our peer organizations in Arizona. Elective surgeries have been, for the most part, canceled. 0 visitors allowed in our facilities right now. COVID patients have been cohorted into specialty units. We've even incorporated telemedicine for these cohorted patients so we can limit how often patients, caregivers have to go into a patient's room. And that has been very valuable. We've tested it in 2 facilities. It's going well. And now we're probably going to expand it to all of our facilities. Again, it's a way to protect caregivers in a significant way. We're also using this in a live way in Tucson with a skilled nursing facility that has had a breakout. And we have equipment there that allows physicians off-site to be able to provide the consultation and the advice and counsel on what to do with those patients as they are developing symptoms. We're redeploying staff all over the place. Some of you may have seen that we sent about 10 nurses up to a facility in Greeley, Colorado yesterday through the donation of a private airplane by Jerry Moyes to help out our beleaguered staff at our hospital in Greeley that we own, who have a very, very significant outbreak up there. And it's a learning process so we can see what we're probably going to be faced with down here over the next 4 to 8 weeks. We don't see this dying out for us until reaching a pinnacle. And the pinnacle we see is about the 3rd week of May. And again, these are all projections based on modeling. But while we will have surges that are going to occur later in April, we don't see this being a pinnacle until May, and then it's going to continue for a period of time after that. We don't, and from our perspective, and planning perspective, we see we're going to be dealing this with a number of months after that, well into the summer or the late summer. We are testing certain things on trying to preserve supplies. This is the biggest issue right now. It's called PPE, personal protection equipment. And it's N95 masks, it's blue isolation gowns. These are very hard to come by, and the reason they're hard to come by, the whole world wants them. So you're looking at the world to try to find supplies to support that. We, like everybody else, are doing that. In some cases, in ours in particular, we stood up a mask manufacturing plant last week with our own facilities and our own people, who last week made 7,000 masks of procedural masks, not these N95 fancy ones, but the procedural masks. And we're going to make thousands and thousands of those every week, and we're gearing up to do that in a very production way. We've contracted with 5 or 6 corporations in Arizona to make face shields, which are the ones that cover the masks, and we're using 3D printing to get that done. And our Banner Innovation Group has worked with these outside organizations to start cranking those out. We've worked with a company like Oso, which is a restaurant and brewery, and they're making, obviously, sanitizer for us. And they've made about 100 gallons. They'll do 400 more gallons, and their only limitation to helping us with that is getting the alcohol that they need to produce it. And if they can get the supplies, they'll keep cranking that out, which hopefully will take away the shortage that we have had in trying to find that particular capability and need for our organization. Clearly, we need in this state far more aggressive social distancing. This is the key. And you only deal with this particular problem in a few ways. One, you have to test, and test. Then you have to isolate. Then you have to look at contacts and isolate the contacts. And then you have to practice extreme social distancing. We have not done that in this country, and that's part of the reason the country has had the problem. We wouldn't take the actions early on that you see being taken in a number of other countries. And it's true in Arizona. We have, in kind of an incremental way, grown into this issue and have done things little by little by little. It would have been probably preferable if as early as 8 weeks ago, we started to take much more severe actions to prevent the kind of breakouts that we see in New Orleans, that we see in New York, that we see in Seattle, that we're likely going to see in LA up next. And these are concerns, obviously, but social distancing is the real issue. And the bottom line of that is, here's the advice I would give to everybody. Number one, stay away from people. Don't congregate with groups. It's too risky. If you've got to go to the grocery store or you've got to go to the drugstore, go do it. But otherwise, don't be hanging around with groups. It's too risky. This is a serious, serious virus, and people have to take it in a serious way. And it's one we have never seen before, and that's why it's so hard to deal with it, not only from a science perspective, but from the caregiver's perspective. We have to protect our caregivers, and the best way to protect our caregivers is don't go into a healthcare facility unless you absolutely need to do that. Wash your hands and do it frequently, multiple times a day. If you get a cough, cough into a Kleenex and get rid of that Kleenex. Don't cough into the air. And stay home. If you're ill and you don't feel good in the slightest way, stay home and stay away from the public environment. 80% of patients around the country, you hear a lot about the hospital problems and the kind of death and dying that you see occurring, and what that was shown in the 60 Minutes session yesterday night. But 80% of patients are managing this. They can manage it on their own. The symptoms will tend to be mild. Doesn't mean they can't get worse, and it doesn't mean somebody can't get to the point where they have to be hospitalized or have to be put on one of these short ventilators that aren't readily available. But you can stay at home and you can get medical advice, like I said, through Banner's site to do that. The symptom checker will help you do that. And at the end of the day, help us to show some gratitude for our caregivers. If you go to #HealthcareHeroes on social media, these are people that are coming in every day and knowingly put themselves at risk. Now you can say healthcare workers always do that, but nothing like this. Nothing as broad spread as this. I'm constantly trying to send information out to our own employees, encouraging them to do what they do and to look at them as heroes going into battle. Quite frankly, we're looking at this as a war. This is about going into battle. And in some cases, we aren't able to arm them as well as we would like because of the shortage of supplies around the world. I suspect after all this, the world will learn, and we will learn in the US, that we probably can't be dependent on the rest of the world to produce the level of supplies that we need. And I suspect you're going to see a lot of this manufacturing coming back into the US from around the world to protect us from the next time a coronavirus comes up. COVID-19 is a coronavirus, just like the past ones that you've seen with H1N1, with SARS, with MERS, and with Ebola. These are coronaviruses, but this is a unique one, and that's why it's hard to deal with. So my advice is be smart, let science do what it needs to do over the next year to help us to prevent what's occurring so it doesn't occur again. And just be thoughtful in how you handle yourself. And by all means, stay at home, because I think we're going to hear something about that later in the afternoon if we're not hearing about it right now.
All right, Peter, thank you so much. And just to quickly recap, again, if you know what Peter stressed, if you are feeling ill, the steps that you can take that can really help everybody out, bannerhealth.com, they have the symptom checker there. If there is an issue, they can set you up with a virtual connection. And then those drive-through tests, as you mentioned, Peter, how vital those are in the protection and keeping the PPE, that personal protection equipment. Again, they're not going through that as much, so you can save on that. And then, as Peter mentioned, just more aggressive social distancing, and then just showing our gratitude as we've sort of opened with this, using the hashtag #HealthcareHeroes. You can spread that on social media. Again, Peter, thank you so much. We're going to hit you back in here for a few minutes on some Q&A, but I want to transition over. We talked briefly about the economy, the impact to the economy where we started. We got into the healthcare crisis, and now let's move on to the outlook, the economic outlook. And then I want to transfer and transition over to Jim Rounds. Jim is the president of Rounds Consulting Group, a firm that specializes in economic development, tax policy analysis, education research, transportation economics, fiscal planning, including revenue forecasting and budget developing. So Jim, I know you have been very, very busy over the last few weeks, and I want to bring you in on this and just kind of give you the floor as well as we give into Chris and to Peter here on the outlook, our economic outlook, and some of the things and some of the advice that you have.
All right. Let me build on that healthcare commentary first. Let me cover a little bit of the healthcare economics and then get into the outlook, if okay. In the last couple of years, I really had a chance to get to know the healthcare industry well over dealing with funding for doctor and nurse shortages, federal funding matches, things like that. And it has, I analyzed this in depth, and it's an impressive industry in Arizona. And we're going through this stress right now, but I really believe that we're going to come out of this in a positive way once we get through a few more months of pain. And I would like to see the healthcare industry as a whole take an even bigger part in the state's future. I think we are going to see additional activities come back to the U.S., and I think that Arizona is going to be a great place for that. So on that side, I feel very good. I also have enjoyed the messaging and the level of confidence that the different physicians have offered. And what I'd like to hear from Peter is I have to actually check into one of his banners on Wednesday for a couple or 3 days, and I have complete faith in staff. The safety protocol and everything has been fantastic, and so I'm going to get a chance to witness this firsthand, but so far I've been very, very impressed. So I want to take that as an example industry and talk about some of the outlook. The biggest thing to bring up is whether or not we're going to have this V-shaped recession that people have been hoping for, which means a dramatic decline in GDP and economic activity in the second quarter, maybe 0% growth or something close in the third, and then we start to surge. Now, I don't know if we're going to surge in the fourth quarter or if it's going to be the first, but we are going to see some pent-up demand. There's going to be some strains. We're going to have more national debt, imbalanced budgets. But overall, we're going to pick up some of the activity that we're losing right now on the back end. The key is to figure out to what extent are people going to change their behavior, because after the 2008 downturn, everybody did change their behavior. Most people were thinking, well, people demand apartments for a little bit and then they'll go back to single family housing. But that was such a long and dramatic downturn. There was a social issue. It wasn't just purely economic. The economic stuff usually happens over a couple of years. The change in society happens over more. I think we actually might see a bigger change in how people might want to work more from home, telecommute, dealing with telemedicine, again, dealing with the healthcare industry and other opportunities to bring manufacturing and other high value added jobs to the state, focus on education more. But we're going to be faced with some pretty significant fiscal constraints. And it's looking a little bit more like a U-shaped recession is developing. So we are in recession already. This is going to be devastating in terms of the GDP losses and job losses, but we will get many of them back. The longer term consequences, when we get into businesses such as restaurants and smaller businesses, we're going to see a lot of our favorite stores and small businesses close up, and we're going to see the larger corporations come in. So instead of going to your local coffee shop, there might be another Starbucks or an Applebee's or a Chili's instead of something that you previously wanted to go to. So the world's going to change some, but the key is to figure out, and Chris brought up a bridge to a bridge, and we've been talking about building a bridge over this downturn. And on the front end, it's kind of like the old, you see those old Wild West bridges where you build the train bridge on one side and then the other, and eventually they meet and the train can cross. So on the front end, we're trying to figure out how to get a lot of these businesses through this tough time. And people have been brainstorming, but it has to start rolling up into some hard ideas. We actually need to convert the brainstorming into specific policy changes. And then, GPEC and others have also been talking about building the bridge from the other side, which means how do we shore up our ability to accelerate out of this economic downturn, maybe do so much better than most of the other states. And that's where we were set up before. We were set up to have one of the best expansions in our history during the 2020s. And what we're seeing right now is the 2022 recession, 2023 recession that was being forecast, we're having now. That's no longer at play. We're going to have a decent expansion after this, but things are going to be different. It's going to be challenging to get through this. And I really like the idea of developing programs that maybe require certain entities to assist in, one way or another. But I love the idea of having some kind of a promotion about how do we let people know that you need to look out for your neighbors. Is it possible that some landlords might have more personal conversations with the tenants and figure things out? Is it possible that some small business owners or even large businesses, if we can educate them on how the downturn is going to look, it may be worthwhile for them to keep some of those individuals. One, it would be the right thing to do to at least try, but two, training costs and things like that. So I think it's about getting information out there. So it was like on the healthcare issue. We had to figure out how to get more information about what's going on and make decisions. And now it's getting to, on the economic side, how do we go through and figure out where we're going to trough? What are the risks if it's a shorter downturn versus longer? And how can we coordinate? And when we had the 2008 downturn, we weren't very coordinated. We had no economic development tools. It was very weak. And we changed the foundation. And I'm really hoping that we can take an opportunity to learn from additional mistakes, but also identify our strengths and see if we can be stronger coming out of this one as well.
Thank you, Jim. And I'm going to bring Chris from GPEC back into the conversation, because now that we've had a chance to go around the table a little bit and talk about the way we're all collaborating and some of the advice that we've outlaid here today. Chris, give us some thoughts on what you've heard in the last 30 minutes, and again, how we started of, the hashtag Greater Phoenix Together, or bringing people together. Can you kind of allude to what you've heard over the last 30 minutes and the next steps that we need to take?
Sure. I guess I'll officially launch my GoFundMe account for my modem, because I think I have troubles on my side. So I hope you can hear me and hope it's clear. Just to summarize what I heard from Peter, just the dire need for us to distance socially, and let's ensure that we're taking that extraordinarily seriously at this time. We have a number of weeks ahead with the war zone, and just want to make sure that we're respecting that. I'll continue to work together along with our communities and our state partners. We think there's an incredible opportunity for our communities to come together and really map out the relief loan programs and how we support all these companies that are going to need this support going forward. So with that, I will close. I want to thank everybody for joining us today. And Eric, if you have a final comment, I appreciate it. And thanks, Peter and Jim, for joining us today. There will be upcoming panels focused on supply chain and other that will be relevant for our economy moving forward.
Yeah, guys, I wanted to just bring it back to Peter real quick. Peter did mention, this could happen at any time, and I guess the order just came down from Governor Ducey, the stay-at-home order. I'm just getting some information on it right now. Everything except essential businesses. I believe grocery stores will be staying open. We'll learn more about that. But I just want to ask you, Peter, about collaboration, because you just mentioned, within your organization, teams going to other states to work with other hospitals to learn. What have you seen when it comes to the county medical system, the private sector healthcare firms collaborating to handle the number of COVID cases?
Well, there's a lot of collaboration going on between the health department and some of the other big systems certainly in the Maricopa area. We have to do that because not one of us can handle the volume of cases that's coming down the pike over the next 4 to 8 weeks. Nobody can. Nobody has enough vents. Nobody has enough ICUs. We're going to have to see who can handle these patients and at what levels. And then when you have these breakouts, you can't just look at one organization and say, just go deal with it. We see what's going on in Tuba City right now and the stresses and strains it's putting on that organization. And then it flows over to Northern Arizona Healthcare and Flagstaff from that as well, because of these cases coming off the Navajo Nation. We see what Banner's dealing with this case in a nursing home in Tucson. That's a hot spot. And so collaboration is key, and our chief medical officers are talking and meeting with some frequency in order to understand what we are all doing including obviously coming up with an answer if we run out of ventilators, which we likely will. How are we going to make the decision as a community on who gets a ventilator and who doesn't?
Right.
If you look at Italy, if you're 60 years old and above, you're not getting a ventilator. And we're hopeful that we won't get to that point.
And then I know you've touched on this briefly, but just in your experience, and we're still very much in it. As you said, we could peak here in the next few weeks, and then also the third week of May. What have we learned about this pandemic that can set us up for success battling future pandemics?
Well, you know, we learned a lot from the previous pandemics of H1N1, for example, Ebola, MERS, SARS, but we didn't listen to what we learned, and we didn't act appropriately. If you look at the strategic reserves, they were chock full during the Bush years, and then they got depleted from pandemics. And then we went through the years of the Obama administration and then the early years of the Trump administration. We didn't put those reserves back in place. Remember, in a pandemic time, hospitals have to do what they would normally do. And if something like this happens, they turn to the strategic reserves for supplies, and then that gives time for industry to gear up and do what they need to do, as GE is doing right now, as Ford is doing right now, as 3M is doing right now. But the strategic reserves were intended to give us that 6 months to 9 months time so industry can reorient. Hopefully we will learn that lesson this time, and hopefully we will bring back that manufacturing capability for critical PPE supplies back into the US.
Thanks, Peter. I do have a question here for Jim. Jim, how do you expect COVID-19 to affect development here in the Valley, specifically the dozens of mixed-use developments that were just getting underway? What do you see happening as far as that industry goes?
Well, the real estate industry, it's very complicated because one business ties into another. You provide relief to tenants on the commercial side. You're also making it difficult for the landlords to make payments. On the residential side, I think it's going to be a combination of the haves and the have-nots. Those individuals that aren't as financially impacted by the virus and can weather the storm better may find solid buying opportunities with the lower interest rates. But we're going to be losing so many jobs, and it's not going to take a lot for individuals to lose their homes. And so I think there's a little bit of upside for some individuals, a lot of downside for others, but it's something that we have to figure out. There have been discussions among some of the more prominent real estate groups. Valley Partnership has been very active in dealing with this, and I've been very impressed. It's a matter of bringing some good ideas together and seeing if we can work out something, because when it's triage and you're basically maximizing what you can get out of limited resources, we have to do the same thing with making these things work. To the extent possible, you want to leverage funding to get an economic gain, because even that $2 trillion package is going to last 3 months to 6 months. And beyond that, we're going to have to be looking out for ourselves for a little while. So I don't think prices are going to fall. I don't think they're going to collapse too much, but some folks are going to be hurt.
Yeah, and this is, really on the spot here, Jim, because we're just learning this information now, understanding that people will likely need to stay at home for the next, 1 to 2 months. So how do we keep the local economy going, along with keeping our communities safe with that part of the equation?
Yeah, and we need people to be healthy, but people also, their health depends on the economy, especially if you have insurance issues, things like that. So we have to find a balance, but the health of an individual is more important than the overall health of the economy, but we can try to work on both at the same time. It's just something where we're still on the front end of this. And I always like to do these economic updates and feel like I have a lot of really solid answers. This is the first time in a while where I feel like I just don't know for sure. And maybe it's a matter of getting a bunch of different folks together and chatting and making a list of options of things that we can do, and then play advocate and devil's advocate and see what we can figure out. But ultimately, all of these discussions have to translate into a list of certain people doing certain things as quickly as possible.
Chris, I want to bring you in on that topic as well. Just get your thoughts again, now that we may be home for who knows how long. What can we do? Jim just mentioned getting together, making lists, getting these organizations. What can we do to keep the economy going as things get tougher?
I definitely think that there's a short-term strategy like Jim described. And that's what's happening. You're finding ways that the state and county cities are coming together to support small business through the SBA loan process and loan programs. Longer term, however, I mean, nothing should be off the table as we look at how do we become more competitive for manufacturing and base industries? How do we reform our tax code so that we are the most competitive market in the Western U.S. for advanced industry? So coming out of every crisis like we're seeing, this is certainly one. This is really the time where we did figure out what's the best go forward strategy so that when the sun shines bright again, we're in an incredible spot to take advantage of that. One other item I'd also mention, though, as relates to our brand and our community, and even nationally for that matter, there's been a lot of talk about the inclusive nature of this community, and I want to ensure that it goes without saying, but the Asian American community across the country, because of this virus, and there's no room for bigotry or hate in the equation, and I want to ensure that Arizona and specifically Greater Phoenix stays on the edge as it relates to diversity, inclusion, and welcoming all types of people, and that we shouldn't be in that position as a community. And I would just hope that we come together as neighbors and friends and family to work on this together, because that's what it's going to take.
Thanks, Chris. I have a question. Peter, we just had one come in. Do we know if the COVID-19 virus is mutating, and what does that look like for healthcare issues moving forward?
Well, there has been some speculation that it's morphing, but science hasn't proven that yet. And I think we're still in the early stages of identifying if that's an issue. And the other issue is, when can you come back to work?
Right.
And that's not clear either. So this is so new, we're learning as we go along.
You mentioned, myths or some things we just don't know that much about yet. One of the things I hear over and over here in Arizona is, oh, it's okay when the hot temperatures roll in. Do we know if that's a factor as well? When the temperature starts heating up, is that going to help us combat the virus, or same thing we just don't know yet?
There's some thinking that coronaviruses in the past have been susceptible to heat. And therefore, that's why you see them go away in the time period when the temperature goes up and comes back when the temperature cools down. What we don't know is if this particular coronavirus, COVID-19, will behave like that. And there's some speculation that it might not behave like that. But then you talk to some others, and wishful thinking are hoping that it will behave like that, right, which would give us time then to deal with it later on. But what you would see at that point in time is in the southern hemisphere, you would see it kick up because it becomes winter when we're in summer. So we'll have a better understanding if that plays out that way, but we just don't know yet.
I want to transition back to Jim real quick, because we were talking about, when you were talking about the V-shaped recession here turning into a U-shaped recession, talking about the real estate industry. What about the airline industry? And do you think a potential airline bailout could work, or how would that affect Phoenix?
That's a tough one also. The airline industry is going to be hit hard. There was a poll that I saw recently, I think Harris poll, that said the typical individual is not going to want to fly for a good 6 months to 9 months after we get through the crisis, and people say you're good to go, just because of the fear. And we are going to see far worse numbers in terms of the number of infected, because there's people that are infected. It's just that it hasn't been documented yet. So I think that's going to extend it for a while, but it's also impacting the tourism industry quite significantly. That probably hasn't been discussed enough. It's hard to know what to do at that scale when an industry is that big and dependent on people moving. That's what hit Arizona so hard when we went through the prior recession, is people couldn't move here, and it impacted us much more severely than most other states. Well, we have a pretty significant tourism market, and I think the airline, which is, it was over $50 billion, $50 to $60 billion, I think was the bailout. It probably was needed, but what I can't say is if the dollar amount was appropriate. Federal government is hit and miss when it comes to picking the right dollar amount to go to different places. And historically, the rule of thumb was if a dollar was going to go towards a particular place, about 50 cents in reality was going to go there, and the rest was just going to go into outer space or something. So we have to get more efficient. And this is where I'm hoping that the states participating in these programs will help us out.
Jim just mentioned, the last recession, people weren't moving to Arizona. And Chris, with GPEC, this was right in your wheelhouse. What happens if businesses aren't allowed or can't move here as well? That's, that's what you do is you bring businesses to Arizona. But if people can't move here, businesses can't move here, how does that impact us?
Well, as Jim alluded to, we felt that in 2008 to 2012 when people couldn't get out of their homes and move to the Sun Belt. And I would say it's no different from a standpoint of, think about the trickle-down effect of airlines not running as many routes, and that's what's being planned for the near term. That means less business travel and tourism travelers to this market. And it ties into what I said earlier, whereas we're a market, particularly the window, where we garner or we collect a lot of our transaction privilege checks during that time frame where visitors are flying in from all around the world to spend their money. And so again, we're capturing, unfortunately, this really challenging window of not having tourism that we're used to having. And so I know there's a lot of hard conversations going on in Washington about this, but that's the airport itself. In conversations I've had recently, I mean, they collect fees from planes, and so if you look at our top 10 airport that we have here with Phoenix Sky Harbor, asset to this region, and if we start seeing a curbing or further curbing of flights coming in and out, think of that precipitous impact on the overall regional economy. It'll be very significant. So as Jim alluded, very difficult to measure what the right numbers are, but that is a critical linchpin to our economic development work, is being able to get people physically here. And I know the business development team we have that works around the globe. One thing, there's a consistent theme. When companies visit here, our transaction rate, our conversion rate goes up significantly. So we have to get people here from around the world to physically experience our community and all the assets we have to offer.
Thanks, Chris. We have another question that just came in for Peter. And, you read so much, there's so many headlines, you pick up your phone, you scroll through your feeds, and again, there's misinformation, some accurate, you got to do your research, and it's great to have you here. How long is it taking the average patient to be treated and recover from COVID for the patients here in Arizona?
So if you're talking about mild symptoms, people who are stay at home, probably somewhere between 7 to 14 days.
Okay.
Is what we're seeing so far. For patients, obviously, that get admitted to the hospital, it's tending to be a bit longer. And for patients that are on ventilators, at least ones that are make it being on a ventilator, could be as much as 3 weeks.
Got it. And Jim, you mentioned, or Peter, you mentioned earlier the team going to Colorado, and yes, you're helping, but you're also learning there as well. What are some of the things you're hoping to learn about how the disease and how things are being handled over there?
So that's one of our other hospitals in Colorado, and we're learning about how our employees have to deal with this. Part of this is not just the technical; it's the emotional.
Right.
And we're finding this to be quite difficult. Interestingly, we had one patient up there that was the husband of one of our nurses. And because of our own rules, she couldn't go in to see him because then she was a visitor. And he was on a vent and likely might not have made it. But 3 days ago, last Friday, 4 of these patients came off their vents, which means then they had the chance to now fully recover because they were breathing on their own. And one of those was that woman's husband. And it was a glorious day for us right there. It's these small wins that make such a big difference for our caregivers. The small thank yous for the caregivers. They are doing a lot. So we're learning from that aspect of the emotional relationship of trying to take care of patients in that fashion. Plus, we're learning the issues about how do you deal with patients when you're dealing with short supplies of personal protective equipment.
Yeah, and it deserves echoing. You know what you said earlier, just gratitude for our healthcare heroes, and I think that's why you were so passionate about it when you were talking earlier. And we all know somebody in the healthcare industry right now, and what they're going through. So again, spreading that message of gratitude to all of our healthcare heroes out there. I do have a question for Jim. What is the outlook on tax revenue right now to complete city projects?
It's not looking great. We're having a really strong fiscal year up until, the end of February, partly into March. Um, the 10%, 8% growth, whatever scale it was at the different communities, is probably going to lose about a third of that with this really weak second quarter. It'll make it difficult to continue projects, but I'm trying to figure out, brainstorm with some of these real estate, folks that are coming up with ideas. Is there ways of keeping some of the projects going, transportation infrastructure projects, where maybe a low borrowing rate will allow a project that was in a community's capital improvement plan 3 years down the road can be moved up? Now we'd have an issue with the construction workers working in close proximity, but I'm sure that there's ways of that they tend to be spread out a little bit farther on these bigger projects anyways, and the work sites are isolated. So I think we have to figure out what can go forward in a tight budget. And a lot of communities were having problems with pensions and other things, even in these great economic times that we've been having. And so there'll be a reckoning on that at some point. But if we can think of ways of keeping business activity moving, like even with the restaurants, the dine-in takeout issue, I think we'll be in a much better shape.
We're going to wrap things up here in just a minute, but one last question to everyone, and I guess I'll start with you, Jim. In your opinion, what can everyone do to just make a difference right now? We've all kind of had that part of us that says, here's what we all need to do together as a community. But just hearing from you, Jim, you're a very influential leader in our community. What can we do? What can we do to make a difference?
I think we have to be responsible and not be floating around out there in different Corona parties that people are having, or going to a Mardi Gras that we saw in the news. We have to isolate, but we can be productive, as we're seeing what we're doing right now. But the thing that hit me the most today was the multiple discussions that I heard over the last few hours on how can we deal with this as a team. How can a small business like mine retain an extra employee where it might not make financial sense, but it's the right thing to do? Well, if one person can do it, that a larger business can do it with hundreds, and they can do this on a voluntary basis. And so I'd like to see a little bit of a campaign related to that. And it sounds like Chris has already been looking into this with GPEC. So that's fantastic news to hear.
And Peter, I'll ask the same question. I know you were very passionate about, social distancing. In your thoughts and closing here, what are some things we all need to do to make a difference?
Well, one, be smart. Don't do silly things that put you at risk or put your family at risk at this time period when this virus is so aggressive. Two, manage your situation. I've been working at home for almost 2 weeks now. I'm running the company. I'm on the phone all the time. I'm texting, I'm videoing. I go in the office to do videos to our employees. You have to think of different ways of conducting yourself and conducting your business activities during this time period. I'm a little bit older, so I'm a little bit more at risk, so I have to protect myself maybe more than others do. But it doesn't mean I can't be doing what I need to do.
Right. And just listening to you, watching you talk, you're in the thick of it right now, and you've got a positive attitude, and you're telling us what we need to do, and you're just, you're laying out the facts for us. And so I love that positive attitude and just helping us frame perspective on the crisis right now, and transitioning over to Chris now with GPEC. Same thing. You're on economic outlook, and we don't know what that future looks like, but what can we all be doing to make a difference right now?
Yeah, I would just say, number one, we got to follow the stay-at-home order. So that was put out today, and a lot of states are going through this. It's uncomfortable, but I will tell you, this is for the betterment of the region. It's a must. And so I know that Jim and Peter only stated that. And I'd say the other is, this creates a different kind of family and home environment for people. And so I would ask that, again, take out the business side of all the things we're dealing with and the number of hours we're putting in. Call your friends and family. I mean, something that's said during this time is really important, that we stay together, even though we're not face to face. But now all these communication tools enable us to still, stay relatively connected. So I'd encourage people to do that for the betterment of our community. And lastly, I would say to what Jim had referenced, our communications and marketing team had put together this Greater Paychecks Together hashtag, tracking and capturing a number of different stories of people helping people on the front line, celebrating healthcare workers. Again, where a lot of the corporate community step up and, whether it's bedding companies creating beds for hospitals or, grants from philanthropy going into, supporting manufacturing of PPE. So those are all things that we're enriched by in our community. And I would ask any of the viewers still to submit any of your stories you have to us, because again, that's part of coming out of this, is celebrating the positive. And so while we're in the trenches, working with Peter and Honor and Dignity and all of our healthcare partners, let's ensure we're celebrating them being on the front lines, and at the same time, let's celebrate the community together.
Yep, and Chris mentioned the hashtag Greater Together. Peter mentioned his hashtag Healthcare Heroes. And a big thank you to everybody joining us today. Chris Camacho, President and CEO of GPEC, Peter Fine, President and CEO of Banner Health, and Jim Rounds, President of Rounds Consulting. Just a reminder, we will be doing these weekly in the coming weeks. Next week, we are planning on the topic of global supply chain. And then the week after that, community in action. So once again, just want to thank everyone for attending. Thank Chris, Peter, and Jim for joining. And please look for the webinar registration coming out in the coming weeks for global supply chain and community in action. Thanks again for joining us and taking the time with us this afternoon.